each side. They are occupied by other cavity that is termed as pleural cavity. These are responsible to lodge the lungs on both sides, and all the remaining structures of the thoracic cavity are present in the mediastinum. So the middlemost cavity of the thoracic cavity is simply the mediastinum, and it contains all important vital structures of the thoracic cavity except lungs. All the important structures are present in the mediastinum. So we can say the mediastinum is a cavity that contains all important vital structures of the thoracic cavity except the lungs, and they are present on both sides of the pleural cavities. You can see in this slide, this is the pleural cavity that is occupied by the lungs, and this middle part is occupied by the mediastinum. And that middle part, the mediastinum, is divided into two parts, further two parts, superior and this is a transverse section. Now the further division of the mediastinum, the superior mediastinum and the inferior mediastinum. Later on, the inferior mediastinum is further broken down into anterior, middle and the posterior mediastinum by the due to the presence of the heart. The heart is occupied and it is present in the medial mediastinum. So the inferior mediastinum is divided into three more parts: anterior mediastinum, middle mediastinum and the posterior mediastinum. We discussed in detail the superior mediastinum, the contents of the superior mediastinum, the anterior mediastinum and the medial mediastinum. Today we will discuss the contents of the posterior mediastinum, the two important contents, plus we will recall also the important components of the superior mediastinum and how it is divided, the whole mediastinum. Just have a look on this slide showing the sternum, the boundaries of the thoracic cage. The sternum, you can see in this slide, the sternum, the three parts of the sternum, the vertebral column, and on both sides, on each sides, bilaterally, it is covered by the ribs and the costal cartilage. Now, how this mediastinum, the space of the thoracic cavity, the whole thoracic cavity consists of pleural cavity on right and left side, and the middle is occupied by the mediastinum. Now, how this mediastinum is divided into superior and inferior part? Superiorly, there is superior thoracic aperture or the thoracic inlet that forms the superior boundary. Inferiorly, there is an imaginary line that divides the mediastinum into superior and inferior, and it runs from the manubrium sterni to the lower border of the fourth thoracic vertebrae. Anteriorly, this will form the manubrium, will form the anterior boundary of the superior mediastinum, and posteriorly you can see the T1 to T4 will form the posterior boundary of the superior mediastinum. Now moving on to the inferior mediastinum. This is the inferior mediastinum, and that inferior mediastinum is divided into three more further parts due to the presence of the heart in the middle segment. Middle compartment lodges the heart, and it is divided into anterior mediastinum, the middlemost part that is composed of heart, and the posterior mediastinum. This space is the posterior mediastinum. Below the superior boundary is formed by imaginary plane that passes from the manubrium sterni to the lower border of the fourth thoracic vertebrae anteriorly. Now generalized, this is the generalized boundary of the inferior mediastinum, not the posterior mediastinum. Anteriorly by the body of the sternum and posteriorly from T5 to T12 thoracic vertebrae. And if I am talking about the boundaries of the posterior mediastinum, now here the mediastinum is divided into anterior mediastinum, middle mediastinum and the posterior mediastinum. Again, posterior mediastinum, now we are concerned with the boundaries of the posterior mediastinum. Then superiorly by imaginary plane, lower border from the manubrium sterni to the lower border of the T4 vertebrae, anteriorly by the heart, pericardium, posteriorly by the vertebral bodies T5 to T12. You can see in this slide, these are the vertebral bodies that will form the posterior boundary, and inferiorly by the diaphragm. This is the diaphragm, which is a partition between the thoracic cavity and the abdominal cavity. You can see. So many structures passes from the thorax into the diaphragm, into the abdomen by piercing this diaphragm. And we discuss in detail diaphragm having three big opening, caval opening, esophageal opening, aortic opening, and small openings are also present for the greater and lesser splenic nerves. Sternocostal triangle में opening थी to pass different structures. So this is the boundary of the posterior mediastinum. I hope by repeating again and again, now you are able to learn the boundaries of the mediastinum and how it is divided into superior mediastinum and then the inferior mediastinum. This inferior mediastinum further divided into anterior mediastinum, middle mediastinum that is composed of heart and the posterior mediastinum. Only two or the anterior, this is very narrow space that is present in the anterior mediastinum. This is the anterior mediastinum, and it contains sternopericardial ligaments. You know what they do, the sternopericardial ligaments? They help to attach the heart to the sternum. These are the ligaments. They attaches the pericardium to the sternum. Sternopericardial ligaments. These are 1 and 2. The 2 in number, and they just join the pericardium to the sternum, to the body of the sternum. Now, again, this is a slide showing the lower border of the T4 vertebrae, the plane by how the mediastinum is divided into superior and the inferior. This is the sternal angle, lower border of the T4 vertebrae. Just learn this. Keep this in your mind. Then you are able to understand, to learn the boundaries of the superior mediastinum and the inferior mediastinum. There is no difficulty if you remember this slide. Then you are able to learn to memorize the divisions and boundaries automatically. This is a slide again, the lateral side view showing the mediastinum and the diaphragm. This slide highlighted the diaphragm, how it forms the inferior boundary of all the inferior mediastinum, the different segments of the inferior mediastinum, anterior, middle, posterior. Here you can see the diaphragm. Superior thoracic aperture. Now this is a slide showing the components of which mediastinum. You will tell me. This is a slide showing which, in this slide, which mediastinum is highlighted. Okay. And superior mediastinum, Zahra, very good. Superior mediastinum. Middle mediastinum, yes, you are also right, because it is showing the heart after dissecting and removing the sternum, the sternopericardial ligament. But the most highlighted area in this is the superior mediastinum by the presence of the thymus that is present in the superior mediastinum, the windpipe, the different nerves and vessels showing in this slide predicts that this is a slide of the superior mediastinum, the phrenic and the vagus nerve, the brachiocephalic channels. This is a slide showing the superior mediastinum. These are the components of the superior mediastinum. So by practicing this and visualizing again and again, you are able to identify by this slide, just you are able to identify the superior mediastinum. The thymus is present, which also indicates that this is a slide of the superior mediastinum. Windpipe, alimentary tract, esophagus. Esophagus is also a component of the superior mediastinum. Later on, it passes down to the posterior mediastinum. This is a model, and you should see the models for the mediastinum, for the lungs, the different lobes of the lungs, the vessels, all these you can learn by observing the models. This is a slide again showing the vessels, the subclavian, the brachiocephalic, the superior mediastinum. Here you can see the superior mediastinum. The trachea, the bifurcation of the trachea, the esophagus. Now here you can see the posterior mediastinum, thoracic aorta. This is the thoracic aorta. Arch of aorta is over there, and here you can see the posterior mediastinum. After removing the heart, we are able to observe to approach the posterior mediastinum. And you can see this is ideal model showing all the components of the posterior mediastinum. You can here is the superior mediastinum and the diaphragm, the domes of the diaphragm. Now look at this slide. Also, the right dome of the diaphragm is a little bit higher level than the left dome of the diaphragm. This slide. Now, how the esophagus entering the esophagus, piercing the diaphragm and entering into the stomach. So models will help you a lot to learn to retain. Now the posterior mediastinum, we are done with the boundaries of the posterior mediastinum, the superior mediastinum, the contents of the superior mediastinum. Then we discuss in detail the content of the anterior mediastinum. Sternopericardial ligaments are very important. Then the middle mediastinum, which is occupied by the pericardium and heart. Now moving on to the posterior mediastinum, which is the inferior mediastinum division. Posterior mediastinum, inferior mediastinum is divided into anterior, middle, and the posterior mediastinum. Now the components, the structures of the posterior mediastinum, esophagus, that is present in the superior mediastinum, and then it goes into the posterior mediastinum like this. And later on it passes through the diaphragm. We will discuss in details. The arteries, the important vessels, descending thoracic aorta, thoracic duct, veins, azygous, hemiazygous vein, lymphatic trunks, the channels, the lymph nodes, posterior mediastinal lymph nodes. These are all are the components of the posterior mediastinum. I am repeating again: the esophagus, descending thoracic aorta, azygous, hemiazygous vein, lymphatic trunk, posterior mediastinal lymph nodes, nerves, vagus nerve, splanchnic nerve, the lymphatic trunk. All these are the components of the posterior mediastinum. Now the esophagus. The first component of the posterior mediastinum. Esophagus is a narrow fibromuscular tube, and it starts from the mouth of pharynx, and it starts from the pharynx and then it ends after piercing the diaphragm at the cardia of the stomach. Now this esophagus, the whole tube-like structure like this, and it is made up of muscles and fibers. So many fibers and muscles will make the esophagus. Upper 1/3, middle 1/3, it is divided, and then it is divided into lower 1/3. The whole esophagus, lower 1/3 contains the both skeletal and the smooth muscle fibers. It begins with the lower part of the neck. This esophagus consists of three parts. Cervical part, it is present in the neck. Then it is a long part is present in the thorax, thoracic part, cervical, thoracic, and then it pierces the abdomen, and there is the abdominal part. It pierces the diaphragm. So it begins at the lower border of the cricoid cartilage. Cricoid cartilage we discuss in detail. The thyroid cartilage, the cricoid cartilage, the epiglottis. These are unpaired thyroid cartilage. So at the lower border of the thyroid cartilage, C6 vertebral level, it starts and it ends at the cardiac orifice of the stomach, 11th thoracic vertebra. This is the thoracic part. We are concerned with the thoracic part of the esophagus. Now this esophagus, which I told you, consists of three parts. It is divided with longest is the thoracic part, cervical part, thoracic part, and the abdominal part. It starts from the cricoid cartilage C6 vertebral level up to the T11 vertebral level. Cervical part, thoracic part, and the abdominal part. Thoracic part extends from the superior border of the mandibular sterni and it ends into the esophageal opening in the diaphragm. Now, the narrowest part of the esophagus is where it starts, the cricopharyngeal sphincter. जहाँ पे pharynx convert हो जाएगा, esophagus में ऐसी होता है ना, trachea given by tube, it converts pharynx, it will convert into the larynx, will convert into the trachea, and pharynx get converted into the esophagus. So the narrowest part at the commencement of the at the point cricopharyngeal sphincter. This is the narrowest part of the esophagus. Now, there are three parts of the esophagus: cervical, thoracic, and the abdominal. Thoracic part of the esophagus is present in the posterior mediastinum, and it is also present in the superior mediastinum. The esophagus initially lies in the on the left side of the superior mediastinum. Later on, it is shifted to the median plane by the arch of aorta. And in the superior mediastinum, the thoracic duct occupies the left side. Initially it is on the left side, then it goes shifted to the middle of the superior mediastinum. We are talking about the superior mediastinum because the thoracic segment starts from the superior mediastinum, then it enters into the posterior mediastinum. The esophagus is a large tube and it is present in this neck region, in the thorax, in the abdomen. Thorax maybe it is present in two parts. Superior mediastinum, it occupies the superior mediastinum. In the superior mediastinum, it is present on the left side initially, then it moves in the median plane, and later on it again becomes on the right side, in the superior mediastinum. Then it enters into the posterior mediastinum. There are different constrictions in the esophagus. These constrictions, four constrictions. First constriction, again at the pharyngoesophageal junction C6, incisor teeth is used as a landmark. Constrictions, narrowing of the esophagus. It's simply the narrowing of the esophagus. At few points, the esophagus long tube get narrow. Now, where these constrictions are present, the cervical part maybe it is present, and three constrictions, we are concerned with the thoracic part only. Three constrictions are present in the thoracic part. Cervical part, but I put slide showing the cervical constriction also at the pharyngoesophageal junction. Incisor teeth is used as a landmark to calculate the in centimeters. The second constriction or constriction, what is this constriction? It is simply the narrowing of the esophageal wall. Second constriction, where it is crossed by the arch of aorta. The third, this is present in the thoracic part, and this is present in the posterior mediastinum. The third constriction, where it is crossed by the left bronchus. The fourth constriction, where it pierces the diaphragm. Repeating again, there are three constrictions in the esophagus. In the thoracic part of the esophagus is a component of the superior mediastinum, and it is also a component of the posterior mediastinum. Superior mediastinum and the inferior mediastinum. In inferior mediastinum, the kaun se part mein it is present? It is present in the posterior mediastinum. Now the constrictions are present at the level of arch of aorta, at a point where it crosses the left bronchus, at a point where it pierces the diaphragm. These are the thoracic constrictions, and you should learn these constrictions where these are present. This is a slide showing the constriction. Thoracic part, now only the thoracic part, okay? The arch of aorta, there is a constriction present in the wall of the esophagus. Left principal bronchus where it crosses, and at the level of the diaphragm, there is constriction in the wall of the esophagus. Okay, these constrictions can be visualized by giving a patient barium swallow, because in empty esophagus it cannot be visualized. Once the esophagus become filled by the barium meal, what happened? These structures compress its wall and it becomes more evident. Now this is the esophageal opening. Then these are the constrictions. It occupies the posterior mediastinum. Then later on it crosses the diaphragm to enter the stomach, and here it is called abdominal part of the esophagus. And how it pairs the from which part of the opening it appears the diaphragm, the esophageal opening, which lies at the vertebral level T10, along with the esophagus, anterior and posterior vagal trunk also passes. This is the esophageal opening. Now it enters into the abdomen. Now the clinical importance of the esophageal constrictions: site where the solid foreign bodies get stuck at the constricted part, because these are the points where the constrictions, the wall get narrowed, and if any foreign body is engulfed, it get stuck at these stations, at these points. Site where strictures can develop. Strictures can develop at these sites after ingestion of any caustic substances. Sites for the development of the carcinoma of the esophagus. These are the peculiar sites for the development of the carcinoma of the stomach. Site, these are the sites: aortic, bronchus, left bronchus, and diaphragmatic, where the constrictions are present, which it might be he or she, the consultant, the surgeons, might feel difficulty to pass the tube, gastric tube, NG tube. So the constrictions, these constrictions are the site where the consultant can find difficulty to pass the esophageal tube. This is the clinical importance of these constricted areas that are present in the thoracic part of the esophagus. And the esophagus, I told you, it has the cervical part, it has the thoracic part, abdominal part. T10 vertebral level, it enters into the diaphragm. The different constrictions are present in the esophagus. Now this is a slide showing how the esophagus passes from superior mediastinum and then it enters into the posterior mediastinum. Superior, this is the, here you can see the aorta, and this is the esophagus. This is the esophagus. From the superior mediastinum, it enters into the posterior mediastinum. Again, this is a slide showing the aorta, which we will discuss, which is a component of the posterior mediastinum, and the esophagus. Now you can see the esophagus in the superior mediastinum, and then it enters into the posterior mediastinum, and constrictions are present, and later on it pairs the diaphragm at T10 level, and then it enters into the abdomen. This esophagus lies posterior to the root of the left lung. This here is the root of the left lung. I will show you one more slide. A transverse section you can see of the thorax, showing the contents of the anterior, middle, and the posterior mediastinum. This highlighted yellow area showing the posterior mediastinum. You can see in this slide the posterior mediastinum, descending thoracic aorta. Here is the esophagus. Thoracic duct, which is also a component of the posterior mediastinum, which we will discuss in the second slot. Now, the descending thoracic aorta. We discussed in detail the esophagus, the different constrictions that are present in the esophagus, how it pairs the diaphragm, how it enters into the abdomen, and how it is present in the superior mediastinum and how it enters into the posterior mediastinum. Now the descending thoracic aorta, the second component of the posterior mediastinum. The descending thoracic aorta is a continuation of the arch of aorta. Like the arch of aorta is present, and then it gets down, it enters into the posterior mediastinum. So it is a continuation of the arch of aorta. It begins on the left side of the inferior border of the T4 vertebrae, and it continues anterior, it lies anterior to the T5 to T12 thoracic vertebrae. It lies anterior to the vertebral bodies T5, the T12 vertebrae. Thoracic aortic plexus, few autonomic plexus surrounds it. It enters the abdomen. This thoracic duct, descending thoracic aorta, just like the esophagus, also pairs the diaphragm, and through the aortic hiatus, it enters into the aorta. And here it is converted into the, just like the esophagus, it is named as the abdominal aorta. Okay, so descending thoracic aorta, then the aorta descends and enters into the abdomen, and here it is labeled as abdominal aorta. Now, the two things related to the descending thoracic aorta, the thoracic duct, aortic hiatus enters the diaphragm, the thoracic duct and the azygous vein. They are the component of the posterior mediastinum, azygous vein, hemiazygous vein, thoracic duct, lymphatic trunk, posterior mediastinal lymph nodes. It ascends on its left side of the descending thoracic aorta. I will show you the slide. This is a slide showing the descending thoracic aorta, which is a component of the posterior mediastinum. Here you can see the esophagus that lies initially in the superior mediastinum, then it passes behind the descending thoracic. This is a small part of the esophagus also, and they both descending thoracic aorta and the esophagus, they are related to the inferior surface of the. This is the base of the heart. They are related to the base of the heart. This is the descending thoracic aorta. And here you can see the root of the lung, root of the left lung. The descending thoracic aorta, and it is related, the descending thoracic aorta lies posterior to the root of the lung. Here you can see the root of the lung. So it lies posterior. यहाँ पे दोनों side पे, on both sides the pleural cavity is present. After removing the lung, removed pervasive, only the root of the lung is visible. It lies posterior to the root of the lung. These are the intercostal arteries, which are branches of the descending thoracic aorta. So the descending thoracic aorta is a continuation of the arch of aorta, T5 to T12 vertebral level, and then it enters into the abdomen by piercing at the vertebral level, at the aortic opening that is present at the vertebral level, T12. Now, this is a slide showing the azygous vein and the thoracic duct that is present on the right side of the descending thoracic aorta. This whole is the descending thoracic aorta. Azygous vein and the thoracic duct, they both are present on the right side of the descending thoracic aorta. This is a slide again showing the descending thoracic aorta. Here is the descending thoracic duct. This is the thoracic duct. Thoracic duct and azygous vein, they both are present on the right side of the descending thoracic aorta. This is the descending thoracic aorta. Here is the trachea. This is the descending thoracic aorta. Now, this is a slide showing the aortic opening and from where it passes to the diaphragm. Along with the esophageal opening, anterior and posterior vagal trunk goes along with the esophageal opening. Here the thoracic, along with the aorta, the thoracic duct passes through the aortic hiatus. And recall your diaphragm, the aortic hiatus, how it is formed. It is formed by the medial. I told you medial, lateral, and the median. This is the median part, and the both crust, right and left crust, they will unite by the median part, median ligament, and form the aortic opening. What is the complete name of the median ligament? Write down in your chat box. Which median ligament? 3 ligaments बताए थे ना, lateral, medial, and the median ligament. The median ligament is very good, arcuate ligament. Okay, arcuate, lateral arcuate ligament, medial arcuate ligament, median arcuate ligament. So the median arcuate ligament joins the both crust, right and left crust. This is the right crust, left crust. and this is the median arcuate ligament, and it will form the aortic opening. This is the slide. Now, the branches of the descending thoracic aorta in the posterior mediastinum, it is divided in three vascular planes: paired visceral branches, unpaired visceral branches, and lateral unpaired visceral branches. I am repeating again. Three vascular planes for the branches of the descending thoracic aorta: paired visceral branches, unpaired anterior one are the unpaired visceral branches. Lateral branches, laterally it supplies paired visceral branches, and posterior branches to the body wall. Repeating again, showing you the branches. Anterior, midline, three vascular planes. Three, we can say the distribution of for the branches of the thoracic aorta is classified under three headings: anterior, midline plane, lateral plane, posterior lateral plane. Now, the anterior midline plane branches are always unpaired, single, visceral branches. They give branches to the viscera, unpaired visceral branches, anterior midline plane. Lateral plane, they give paired visceral branches. For example, unpaired visceral branches, paired esophageal branches. They give branches to the esophagus. Unpaired visceral branches, example, esophageal branches of the descending thoracic aorta. In lateral plane, they give paired visceral branches, right and left bronchial branches. And the posterior lateral plane. This is the classification for the branches of the descending thoracic aorta. Repeating again: anterior midline, lateral midline, and the posterior lateral plane. Anterior midline plane, posterior lateral plane, and the lateral plane. Anterior midline plane always unpaired, and it gives branches to the viscera. Example, esophageal branches. Lateral plane are always give paired visceral branches. Example, to the right and left bronchus. Posterior lateral plane, they give paired parietal branches. Example, आप बताइए कौन सी होगी एग्जाम्पल? When we discuss the arterial supply of the intercostal space. Yes. Which one? Posterior lateral plane में paired branches to the body wall. What will be these? Yes, any one of you? ये हम पढ़ चुके हैं, we discussed it. Okay, मैं याद आ रहा. Intercostal arteries, posterior intercostal arteries, 3 to 9 posterior intercostal, 3 to 11 posterior intercostal arteries. First two posterior intercostal arteries, from where they originate? First two posterior intercostal arteries. Subcostal arteries, they originate from the subcostal. 3 to 11 posterior intercostal arteries, subcostal, okay? 3 to 11 posterior intercostal arteries, they originate from the descending thoracic aorta, from the posterior lateral plane, paired parietal branches to the body wall. I am repeating again: esophageal branches, right? These are the branches, and pattern of distribution in for the branches of the descending thoracic aorta in three vascular planes. What are these three vascular planes? Anterior midline plane, they are always unpaired visceral branches. Example, esophageal branches. Lateral plane में कौन सी रहेगी? Paired visceral branches, right and left bronchial arteries. Posterior lateral plane, paired parietal branches to the body wall. Example, 3 to 11 posterior intercostal arteries. Few more branches of the descending thoracic aorta. It gives pericardial twig, small pericardial branches to the pericardium, small pericardial branch to the pericardium. It gives a small mediastinal branch to supply the lymph nodes that are present in the posterior mediastinum. So these are the branches of the descending thoracic aorta: esophageal branch, right and left bronchial arteries, 9 posterior intercostal arteries, superior phrenic artery, pericardial branches, and mediastinal also. Mediastinal branch. These are the branches of the descending thoracic aorta in the posterior mediastinum. Into slides and then screen. These are the bronchial arteries. Right, left bronchial artery. Esophageal दिखाती हूँ. Yes, these are the right bronchial, left bronchial. These are the paired visceral branches. Esophageal, unpaired. This is the unpaired esophageal branch of the descending thoracic aorta. Here you can see the descending thoracic aorta, and that descending thoracic aorta in the posterior mediastinum gives branches in 3 vascular plane. This is the esophagus. You can see in this slide the esophagus passing from the superior mediastinum, then later on it enters into the posterior mediastinum. Okay, this X-ray chest showing the different components of the superior mediastinum, the windpipe, the vertebral body, then the superior mediastinum, the pericardium and heart, the vertebral body shadow. You can easily identify the vertebral body shadow in the posterior mediastinum of the posterior mediastinum on chest X-ray. Any tumor or any compression can be visible in the X-rays, radiographs also. This is the mediastinal lesion showing in the posterior mediastinum. Most of the lesions occurs in the posterior mediastinum are neurogenic lesions, and we will discuss in our next slot the thoracic duct, the azygous, hemiazygous vein, and the nerves, how it lodges the posterior mediastinum. This is again the posterior mediastinal mass, the heart, the middle mediastinum, the vertebral column, the posterior mediastinum, this shadow showing the mass present in the posterior mediastinum. One more thing related to the posterior mediastinum: descending thoracic aorta aneurysm, abnormal dilatation of the vessel, and it can be treated, it can be found as during the X-ray incidental finding, and it can be treated by the surgical procedures, endovascular surgery, just by grafting a suction or a suction tube is placed. This is the abnormal dilatation of the descending thoracic aorta, the thoracic part of the aorta, and it can produce symptoms that can lead to the difficulty in breathing, shortness of breath, difficulty in swallowing. It can compress the surrounding structures. This is the clinical anatomy relevant to the posterior mediastinum, the aneurysm of the descending thoracic aorta. Most of the lesions occur in the posterior mediastinum are neurogenic. Nerves are involved. Posterior mediastinum mass, bodies, posterior mediastinal lymph nodes are involved mostly, and small masses appear, shadows appear in the X-rays. Now, what you have to learn in today's the boundaries of the posterior mediastinum. Initially, you have to learn the division of the superior and the inferior mediastinum, then come to the posterior mediastinum, the thoracic, the esophagus, and the thoracic aorta, from where it starts, where it ends. For the esophagus, constrictions. For the descending thoracic aorta, branches are very important of for the posterior mediastinum, and from where it starts and where it ends for the posterior mediastinum. Any confusion, any question related to this topic, and cover this topic from KLM. Esophagus plus the descending thoracic aorta. Any confusion, any question related to the topic, the posterior mediastinum. It is a small topic. I drag it, I disseminate so many things related to the topic. Posterior mediastinum, the two important structures of the posterior mediastinum. Do we have to Descending aorta. Descending thoracic aorta is a component of the posterior mediastinum. So you should do the descending thoracic aorta. Branches of the descending thoracic aorta. Ascending aorta, just go through it. It's very small. 3 to 4 lines are written for the ascending aorta nodes. Yes, whole mediastinum. Yes, raise your hand. Any question? Drop down your hand. Okay. Any question? Any confusion related to the topic? Drop down your hand, please. Any confusion? Any question related to the topic? Is this clear? What are constrictions? Are simply the narrowing of the esophageal wall, and the points where these constrictions are present in the descending thoracic aorta, I told you, at the arch of aorta, at the left bronchus, at the point where the left bronchus passes, and at the level of the diaphragm. Okay, Ariba? They are simply the narrowing of the esophageal wall. Any more question related to the topic? Is this clear to all of you? You're welcome. Okay, good. Cover this topic from KLM. For the branches of the descending thoracic aorta, how the esophagus initially at which position in the superior mediastinum, then later on posterior mediastinum, descending thoracic aorta, it passes to the posterior, it lies posterior to the left main bronchus. Yes, you can cover this topic from Grace also. Grace is also authentic leading book. You can cover this topic from Grace also. Okay. I hope now you are able to understand the divisions of the mediastinum, the concept related to the superior and the inferior mediastinum.